Hello everyone, in this video we're going to be discussing ankylosing spondylitis. Ankylosing spondylitis is going to be presenting with a low back pain in male patients under the age of 40. And the symptoms are characteristically going to be worse with rest. So in the morning or overnight are going to be the classical times when these symptoms are getting worse. It's also going to improve with stretching and warm showers. So this is something to look out for in question stems. Physical exam findings of ankylosing spondylitis are going to include tenderness at spine and sacroiliac joints, decreased spinal range of motion, stiff or stoop posture, or dactylitis, which is the swelling of fingers and toes. Ankylosing spondylitis is a chronic inflammatory process. As a result, it can also present with iriditis as well as uveitis. Uveitis is the inflammation of the interior chamber of the eye, so it can present with a red eye on the physical exam. This inflammation of the eye can disturb vision and ultimately can even lead to blindness. Iriditis is going to be inflammation of the aorta. So, example, there's going to be here's the aorta and there's inflammation going on in the aortic wall, and with this inflammation there can be weakening of the aortic wall, and this can cause a aneurysm formation, and this aneurysm can then pull the valves back like this, and so it can ultimately result in aortic regurgitation. So this is also something to watch out for with ankylosing spondylitis. HLA-B27 is strongly associated with ankylosing spondylitis. Psoriatic arthritis and Reiter syndrome are also strongly associated with HLA-B27. Now, how is ankylosing spondylitis different than rheumatoid arthritis? Well, with rheumatoid arthritis, what we get is constant bone erosion, whereas with ankylosing spondylitis, we also have bone erosion, but we're also going to be forming the bones after eroding them. And this is why we get the classical bamboo spine with ankylosing spondylitis. So if you go to the next slide, here, for example, we're going to be we're going to be destroying this bone over here with inflammation, and then we're going to be forming new bone after the destruction. So as a result, over time, there's going to be fusion of these two bones, and so that can give this bamboo spine appearance.